Hi everybody, I just wanted to cover the case study assignment that's coming out and just kind of what I'm going to be looking for when I grade it. So with this case study assignment, you're going to be asked to create your own case. A lot of times people in the past have gotten this confused and gone and found a case study and copied it, and unfortunately that doesn't work. That's more plagiarism. So we're going to create our own case study, and you're going to have defined kind of parameters on what you are going to pick for a topic to create your case study around. So in the course is going to be the instructions, which should look like this. And on the very bottom of this instructions will be an example case study that one of my students has actually written. I just took that student's information off there. So you can kind of see exactly what they created and what they wrote. So when we first go to topics, here's going to be the topics. Now, I know that we haven't covered these topics yet. We're going to be starting to cover them soon. And so, just hang on to that thought process for a while. If you want to delve in right away, you certainly can. But we will be covering these topics very soon within the course. So here's any of these are conditions that you can pick for your case study. So it should be one of these conditions. And once you decide what topic you're going to kind of go with, then you're going to write your case study. And so here's the criteria that we will be looking at including in the case study for when you write it. So the very first thing you're going to create is your patient story. So the very first thing right here, relevant findings from the patient history and physical exam. When you have gone to the doctor, think about times that you go to the doctor. You go like when you're ill, and you're explaining to them what you're feeling, correct? And that's what we want to see here. So we want to say, Pam went to Mayo Clinic with feelings of abdominal pain, fatigue, shortness of breath, temperature, things like that. So describe the symptoms that your patient will have and anything else that might be important to them, or describe what the doctor might have found on physical exam. You could say, Dr. Thompson discovered enlarged liver and spleen upon physical examination. So those are things that should all go into the first part of patient history. And of course, they should coincide with your disease that you picked out. So when you learn about these, we discuss clinical findings that you see with them, but also when you go and do your research, you'll definitely see clinical findings. Typically with anemia, especially iron deficiency, for example, there's always fatigue, paleness, shortness of breath. Those are common findings with anemias in general. So, make sure that whatever the symptoms and physical history, all that definitely relates to your disease in the end. If you go down here to my example, you'll see it doesn't have to be lengthy. It just has to be pertinent to what it's eventually going to be. So you're going to see here that that's what my person did. You can create the name, you can create age. You don't necessarily have to give a race or ethnicity unless you feel it's important. You can create where they went to the hospital if you want, whatever it might be. So, all right, so that's the first part. The second part is you're going to do lab tests, of course. And in the world of hematology, since this is a hematology assignment, we always want to run a CBC, a complete blood count. So that should include your white count, all the different cells under your white count, so your neutrophil count, lymphocyte, monocyte, eosinophil, basophil. It should include your red cell count and your platelet count for sure. You can include also the MCV, MCH, and MCHC. While you might not know what those things are right this minute, we will be learning those as we learn anemias. So just hang on. We're going to eventually get there on those items. So all of that should go in there, and you should not only give the results for the patient, you have to give the reference ranges for each of those items that correlate back to that patient's age. So if you made that patient adult, it should be an adult reference range for males or for females. If you made that patient a child, make sure the reference range fits for a child. So be careful on that. But yes, you should definitely give those test results right away. So again, if we scroll down to our example, you'll see here, they didn't do the full white cell count on this one, but definitely I would like to see it. But you can tell they did a lot of the other stuff. They gave the results and then they gave the reference ranges. Again, I sent out a reference range attachment, so everybody should have access to those reference ranges. So they did that. And then the next part, what they did is What do they show? So evaluate it. Tell me what's abnormal. Tell me what was high or low. Tell me what was normal. And that's kind of what they went through and did here. Tell me, when we learn about these, you're going to learn that there's terms that go with it. Like you'll see these terms here. So apply the terms correctly. You'll learn all this. So, you know, make sure you answer that question. And then other additional lab results are always going to be, what did the blood actually look like under the microscope? What was the peripheral blood smear like? And so this person went into depth on that peripheral blood smear. They did sickle cell disease, so they're going to see sickle cell stuff here. But make sure that you talk about what you would see under blood smear. And then I want a picture. So go find an applicable picture of that anemia and include that. And that picture should match what you're describing is being seen in that blood smear. So make sure those kind of correlate and match back together. So that should take care of the first part, the second part. And then, so that was screening tests. So CBC is always kind of a screening test to get ideas, same with the blood smear. After that, you always have to do a confirmatory testing. Now that we kind of have an idea of what it is, what other test results can we run to confirm the actual diagnosis? And so depending on the disease you picked, those could be, you're running a ferritin level, you're running a vitamin B12 level, you know, things like that. So you will know based on the disease topic you picked and researching and learning about it, what confirmatory tests are out there to definitely say, yeah, they had anemia, chronic inflammation, or something like that. So you have to also run confirmatory tests and give those results. So you'll notice on this example that that person see what additional testing, and then they gave the different testing that they're going to run. Right there are the results. And then you can even discuss those results if you will. And then of course they said, okay, what is the actual diagnosis? And then they gave their diagnosis. And then we always need to treat it. What's the appropriate treatment for this disease? In the treatment, you should always discuss prognosis for the patient. That's something people commonly forget, but prognosis is a big thing, which basically means, how is that patient going to fare? Is the treatment going to take care of it and they'll recover and they'll be just fine and live a healthy life? Or is the treatment going to maintain and, you know, while they'll always have it, they're going to be okay? Or is their lifespan not so great? Is this something that's only going to get them by for a couple of years? That's prognosis. So always include the prognosis somewhere in here. So again, treatment and prognosis, and then discussion. It should be a healthy, thorough discussion. I don't want 2 sentences. I'm looking for a good discussion on the disease. So when we think about discussion, we should think about, okay, what are things that cause this disease? Why do people pick up this disease? What are the things? Who commonly gets this disease? So what population of people does this typically affect? It could be any different abnormalities that go with it, other tests, thing that we didn't really cover earlier on, life expectancies, you know, how common is this? Like, how often do you find this? Is it a really common thing? That kind of thing. So just a nice, robust discussion on the disease itself to teach the reader about it. And then, of course, you always include all your references there. So when I go back up to the criteria, that should have hit everything else. So the way that I'm going to grade it is seen here. You get 5 points just for organizing it. It should be very clear, formatted nicely. You get 5 points for spelling and grammar. That's a big one. Don't just not spell and check it and all that. That's easy points to lose. I often read my papers out loud because that's when I catch my spelling mistakes. But otherwise, have somebody else read it. If you're a horrible speller, have someone else read it for you. 25 points is document content, meaning, did you meet all of this right here? Did you get everything? That's 25 points right there, all of that. So the main amount of points is from that. And then 5 points for APA. Yes, it has to have a title page. It has to have a reference page. It needs to have headers. It needs to have page numbers. It needs to have 12-point Times New Roman font with the appropriate spacing. It should have citations if you did directly cite or paraphrase from a resource. I'm hoping that most of this is your own student voice and creation. We don't want plagiarism. I don't want the majority copied from somewhere. I'm not going to give points. I want it to be your own work. It shouldn't be too bad to write up. it's simpler to me to write this than it is to write like a 5-page essay. I think this is much simpler, and it makes you learn a lot about that disease, which is important to hematology. So make sure that you meet all of this. Now, when I go back up to organization, if you want to organize your case study exactly the way that this student did, perfect. Do it. I would love it. I actually prefer this organization format. Introduction, question, response, tests, question, response. You don't have to include every single question here. You can do whatever you want there, but I love the way that this is organized here. So you can do that. I would be happy to have it organized in this manner. So if that makes it easier for you on how do you format and write and organize this, copy this exactly how it is, but with your own content, of course. So use this formatting if that makes it a world easier for you. So other than that, I think that should meet everything I wanted to discuss. If you do have questions on this, please let me know. Email me, or we can set up a time to talk it over. As far as deadlines go, all the deadlines will be in the announcements and, of course, in your calendar for the course. So if you're wondering when is this due, you have a few weeks. Please look at your calendar and the announcements for the deadlines, and that should help you. All right, thanks everybody, and have a great time, and good luck writing your